A case of severely deforming ampullary carcinoma, precluding free cannulation of the common bile duct, EUS rendezvous approach with access to the dilated common bile duct using 19-gauge needle, a monofilament guide wire was inserted into the common bile duct, normal looking pancreatic duct. The common bile duct on fluoroscopic view showed that the wire was flipping back and forth and not exiting from the deformed ampulla. Subsequently, a stent was initiated and placed in the extra ampullary site proximal to the deformed ampullary carcinoma location. Stent is visible proximal to the ampullary carcinoma site, successfully placed and draining clear bile with successful decompression achieved in an elderly patient with ampullary carcinoma. Thanks for watching.